I'm Glen Gaulton, Vice Dean and Director of the Center for Global Health at Penn Medicine, and I'm here today with two fantastic visitors from Vietnam, Ms. Thuyen Le, who's the CEO of the Vinmec Health System, and Dr. Linh Le, who is Director of the Health Science component of a new university to be established in Vietnam, VinUni. And both Vinmec and VinUni are important components of the Vingroup, which is Vietnam's largest private corporation. Thuyen, please tell us a little bit about how Vinmec is situated within the Vingroup.
Well, Vingroup has 25 years of development. We started in 1993 in Ukraine, former Soviet Union. Since then, Vingroup has been trying to create a very diversified portfolio across 7 business segments, ranging from property, real estate development, hospitality and entertainment, consumer retails, heavy industry. We start with car manufacturing, and soon will be electronics, agriculture, education, healthcare, and soon you will be hearing us moving into pharmaceutical as well. But with a mission to create a better life for Vietnamese people, Vingroup continue to lead the consumer markets with brand new modern lifestyles with international standard services and products. We are currently recognized as one of the nation's leading private enterprises, and we are having over 50,000 employees with average age ranging from 29 to 30. So you see, we are a very young corporation with a very strong startup mindset. Amongst that, Vinmec is actually a healthcare brand, not for profit of the organizations. We are currently running 7 hospitals with a total bed capacity of over 1,600 beds. We aim to have 10 hospitals by the year 2020 in all the major cities of our country. The 2 flagships hospitals in the north, in our capital, Hanoi in the north, and in Ho Chi Minh City, are JCI accredited. And in addition to the hospital chains, we do have our stem cell and gene technology institutes, and we do have several clinical research ongoing at this point of time.
Right. Wonderful. So what are the primary mission areas for Vinmec?
Well, our primary mission is to deliver first-class health services to our people in Vietnam. Our vision is to become a first-class healthcare system that provides our clients the most comprehensive and professional healthcare services. In the near future, our objective is to become an academic healthcare system that enables us to address major healthcare issues in our country.
And Linh, what are the primary healthcare challenges of the country, and how do you see that relating to Vinmec and the creation of the new health sciences schools within VinUniversity?
Well, there are many challenges, I would say, in Vietnam at the moment. First of all, we are facing with the economic developments, and together with a better lifestyle and better, living standards, we are facing with the epidemiology transitions and the aging of the populations, and you will see a lot of cancers and cardiology problems. That means the non-communicable diseases on the rise. But at the same time, we're still facing with emerging and re-emerging infectious diseases. So that's a big challenge. And together with that, I have to say that the government is now struggling with the model of healthcare and health delivery, and we are shortage of staff. So both quantity and quality of healthcare professionals in Vietnam, and namely the nurses and the doctors. So it is clear that Vinmec, we are suffering as well when we want to develop a highly quality system, because we have to recruit medical doctors and nurses that graduating from the existing medical school and nursing school in Vietnam. And I have to admit that the quality of the doctors and the nurses is not as we expect. And certainly the clinical leadership is another issue we really want to push forward the high quality program clinical services at Vinmec, but we cannot do that if we don't have qualified team and also the highly qualified leaders for our healthcare system. So that actually the reason why we, Vingroup, really want to invest into the new university, VinUniversity. This is a very brand new model in Vietnam, I would say, covering not only nursing school and medical school, but other, business school and engineering as well. So our aim is that we have a highly qualified program, and the nursing program and the medical program will be benchmarked with international standard. We want to have a research universities, and certainly we want to create an impact for healthcare system by best possible clinical services.
So the University of Pennsylvania recently signed, very recently in the last 2 weeks, an alliance agreement with the Vingroup, and the primary missions for this alliance are to help the VinUni develop the health science schools in nursing and medicine, and then in parallel with that to work with Vinmec to address the issues that both Thuy-Anh and Lin have just raised regarding maturation of the workforce, both for health professionals, doctors and nurses, but also to develop leadership. And along the way then to develop an academic hospital based initially at the International Hospital in Times City, Hanoi, and eventually at a new teaching hospital linked to the university. So why did you seek an external partner when you were thinking about these endeavors, and what were the primary factors that led to choosing Penn as your lead partner?
Well, with the very ambitious mission is to become the world-class academic healthcare system, we realized that we have to reach out to find an international partner who are already successful in their journey. And amongst many international institutions has approached us during our call for interest. Penn's, well, of course, Penn is among those institutions. And the University of Pennsylvania and Penn Medicine has set a world-class standards of health education and clinical cares. And besides that, you have a very well-deserved global reputation for what you have been doing around the world. So all that set Penn has very much apart from the other international institution, in addition to over 250 years of legacy of excellencies in whatever areas you have been achievement. So we believe that and confident that together with Penn, we will be able to go through this fascinating journeys at Vinmec.
Great, thank you. Thank you for those nice words, by the way. Lin, this is a huge endeavor, to put it mildly. How do you see the balance between achieving the missions of VinUni and balancing that with the mission and the needs of Vinmec?
So obviously we want to have world-class universities, in the long run. And that means we have to have high concentrations of talents, namely professors and clinical leaders and educators at VinUni Health Science. And of course, there's a mutual relationship between VinUni Health Science and Vinmec. On the one hand, we want to have a great workforce to serve Vinmec. So we need clinical professors and doctors who also deliver best possible services, high quality of care. And we also want to have breakthroughs and innovative research. And we need data, and we need lots of creative thinking so that we can uplift the quality of the clinical care. So certainly the hospital benefits a lot from the clinical professors and researchers from the universities, and of course the workforce of the resident doctors and medical students and the nursing students at the same time. But on the other hand, as you can see, and clearly you practice that in Penn for 100 years, the university health science component also rely on the hospital facilities as a teaching hospital. So then we can educate and mentor our next generations of doctors and residents and nursing workforce. So I think that's a mutual relationship, and this is, I would say, advantage at VinUni and Vinmec. because we, as you can see, Vingroup is the mother corporations, and both VinUni and Vinmec belongs to Vingroup. So we have an opportunity, I would say unique opportunities in Vietnam, at least in the private sector, to create a very, very new model of universities, teaching hospital, and the academic centers, so that we can uplift the quality of not only our faculty member and our doctors and nurses at Vinmec Hospital, but also create an opportunity for our new upcoming students, residents, to learn how world-class healthcare service is delivered, how we come up with breakthroughs and research that create impact for the community in the long run.
Yeah, so those are, of course, the things we do here at Penn Medicine every day and have for maybe not the whole 250 years, but something very, very close to that number. We've both touched on the importance of leaders, and leaders occur at a variety of levels, from junior individuals through mid-level and senior. How important is that to your success, and how do you see Penn helping you and develop those leaders?
Well, to uplift the quality of care in our clinical program, of course, it's a very first and foremost responsibility and challenging task of our leadership teams. Together with Penn, we will have to work together to establish a very high-level strategies, so we would be able to derive whatever is the most benefit of experience from Penn to help us to advance our current system. But we also realize the importance of our middle management, so we have taken the decisions that we will involve a lot of our middle management in all of our hospitals, such as head of clinical service department, chief medical officer, chief operating officer, into different work groups with Penn, so that they can learn and they can grow on how to lead the program effectively and more innovative with Penn support.
Great, thank you. So Lynn, if we step back for just a second and we think overall about the entire relationship, what would be your aspirations for how what we want to build collectively will impact the health care and health services in Vietnam?
Well, I would simply say that we really want to strive for top quality, world-class standard. And we have a world-class research university. We also want to solve health problems in Vietnam for Vietnamese people, first and foremost. So I would say that the most ambitious goal or the aspirations of what we want to do is that to create for the first time a high-quality model of academic system in healthcare. And we can deliver both high qualities of clinical care and services, and at the same time provide the high quality academic program for our futures of healthcare professional. I think that we plan not only to educate the next generations of doctors and nurses who have a very, very high quality clinically and also knowledge and competencies in doing research. But we also want to train kind of leaders in the future in healthcare delivery in Vietnam. And we also to create the next generations of doctors and nurses who have the critical thinkings, have a research mindset, and really want to strive for the best so that we can improve the quality of care in the long run in Vietnam. So we look at this as a more or less like the agent of change for our healthcare system in the future.
Well, that's a great way to say it. I think as we look from the Penn side of this equation, we think obviously not just about impacting Vinmec and VinUni, but making a difference in Vietnam, if not the entire Southeast Asia region. So we're really looking forward to the partnership. So you've had a very, very busy week. We've kept you going nonstop for the last 5 days. Tuan, what's your biggest takeaway from your time at Penn?
Well, this trip to me is one of my most interesting trips overseas. I have this opportunity to meet with different clinical leaders, academic executives, researchers, and I've learned how you develop your organization from time to time, and I also learned a little bit how you striving yourself to be at a very successful position today at, as an world-class academic healthcare system. So I've learned a lot, and my very big wishes take home with me this time is, or in another word, I could say that it is a burning wishes that how I'm going to bring back the concept of Penn Healthcare Innovation Centers and Penn Academy back to Vietnam, so that it's not only creating changes for Vinmec healthcare system, but for the entire medicine in Vietnam as well. I think it's going to be a big impact, and it's going to be an agent of change for our country.
Oh, that's great, thank you. And Lynn, what's your biggest takeaway this week? You've been with us a few times before, but this week was a little different in the people we saw and the types of systems we viewed.
Of course, this is my second visit, and I learned so many new things. But I think I love the way you coordinate with each other as a team, from the top level of leadership to the clinical leaders and the coordinators and different groups of expertise in the system. So like Ms. Yang said, we really want to bring the model of excellence here back to Vietnam and try to make it fit with our local context. So that's very challenging. But I believe that with the support and the coordination from Penn, we certainly can make it work. We have to try our best so that we can make it localized, and we will have to create a new kind of like culture of innovations, of lifelong learning in our staff, in our faculty members, staff members at Vinmec. But certainly we have a lot of opportunity here, and I really hope that we can make it work.
Right. Well, I want to thank you both again for spending your time with us. It's a wonderful partnership, and now alliance is probably a better word, because we're really in this together to develop something very special. Thanks again for spending time with us.
Thank you, Glenn.